And, consistency matters, diligence matters, and legacy matters. So thank you very much, everyone.
I'm going to say that Lindsay has a great deadpan, but she has to have a pause after she says her statements, right? Like as if women didn't exist, dog. Pause. Yeah, they learned the George Costanza and on a high note. There you go. Right. So we're talking. David Dillesque is here, and David came in from Boston, and he has embraced prevention care. He's going to talk about it, and maybe that folds into the whole theme of how healthcare is undervalued. So, looking forward to David's conversation. By the way, we have a great podcast episode from Anna Neckaranic, who's a Wharton MBA, and she talks about how women are going to get about $175 trillion in inheritance and their kids, and they have a totally different way of looking at investing. So, all right, David, do you want to sit or are you going to?
No,
I'll focus. I'll turn the camera to focus.
I'll stand and you have to invite to share my screen.
Give me a second and I will.
All right. All right. Good afternoon. I'm Dave Dillesque. I'm CEO of Embrace Prevention Care, and we're going to switch gears from just about everything else you've been hearing this morning and talk specifically about healthcare and a investment opportunity. So,
Are you logged in right now to?
yeah, I mean,
What's the ID? It's not under David plus, unless it's something else.
look under Embrace.
Oh, Embrace. Okay, so I'm going to invite you in.
Okay.
I'm going to you can just simply yes.
All right.
Next one.
There. Yeah.
And are you doing a share screen? As soon as you do a share screen, we'll take over the screen.
All right.
There you go.
All right. All right. So you heard a number of people talk about healthcare as being an area for investment, especially if we're looking at a down economy. And I'm going to tell you about an area of healthcare that you're probably somewhat familiar with already, and that's dementia. How many people here know somebody that has dementia, have cared for someone that has dementia? Just a raise of hands. All right. So just so you get a feel for the numbers on this, because the numbers are important, is that the number of people with dementia is going to double over the next 20 years. And that's because baby boomers like me and a few other people here in the room are beginning to age into prime dementia years, 75 to 90. And so when the boomers move there, everything shifts, right? So this is an area that is, we see this coming, and I'll explain why that's created a great opportunity for us. So it's a long title, but it's also the agenda. So I want to tell you about how we're going to build $100 million annual revenue business in telehealth dementia care. That's the way that we're doing this. It's very scalable. And this is within the tech-enabled services business, which has been one of the most successful areas of digital healthcare. And that's where you end up making your money. And we get to start doing this within a new protected market, $6 billion market that Medicare just made for us, selected us to be in there with a few other providers. So that's what we're gonna talk through. So we've got a lot of cures for cancer out there, and it's no longer the thing that people fear most in end of life. It's dementia. And you know why? Because there's no cure. You change, you're no longer independent. So this is the biggest cure. We talked about the, people coming into this. There's no current care. There's 127 drugs that are in development. But I've been in healthcare for 44 years. I've developed drugs. We'll be lucky if we have something that's coming close to a cure in 10 to 15 years. It's still a ways out. There's not enough doctors. The average neurologist has a 3 to 6 month backlog for new patients in order to get to see them. And if anybody here has tried to switch your PCPs lately, well, this audience probably doesn't have a challenge. People with money can get access to physicians. It's people that are lower down the income scale that don't. And so as a result of all this, we have caregivers that are taking care of more and more patients, and they're getting burned out. So we end up not having enough care, and that drives up hospitalization rates, preventable hospitalizations. And this is rapidly increasing the costs. The cost for an average dementia patient is $39,000 a year, 3 times higher than the cost of an average older adult, which is $13,000. So there's big money involved in being able to reduce those hospitalizations. So that's what our company has been doing for the last 4 years, is that we have a telehealth dementia care approach that has reduced hospital days by 30% among complex older adults. Now, we hadn't been focused on dementia until this new Medicare plan came along, but these were complex adults with multiple chronic conditions. And we do this by having a nurse practitioner who has a frequent interaction with the patients. They're local. They're able to have at least monthly interaction, preferably via video conference, but it can be only the phone if that's what's available. We also include a pharmacist and a social worker. So it's an interdisciplinary team that the patient and the caregiver has access to. Now, part of the key aspect of geriatrics is understanding what matters most to the patient. As some of you who have more gray hairs like me, you get to a certain point and you realize that you can't do everything, and you have to really choose what you're going to focus your energies on. And so this is where it becomes important in building this relationship and understanding what the motivations are of the patient and the caregiver, to be able to help them focus the energies on the things that they can do that are going to keep them out of the hospital and out of the nursing home. And so through our monthly calls, we have already done a personalized risk assessment. What are the things that are most likely to put them in the hospital? What are the things that are most likely to put them in the nursing home? And then at the beginning of each month, we say, anything new? Has anything changed? Because things can change rapidly. And then we talk about the 1 or 2 actions that we want the caregiver and the patient to work on during that month. I don't know if you hear that, but it's bothering me. What they can do to be able to reduce their risk. And this works because we have a person focused on keeping your loved one or you out of the hospital. There's nobody else in the health system that has that responsibility today, believe it or not. So what's the special opportunity we have? Medicare knows this wave of dementia patients is coming. And so they started a 8-year pilot program called GUIDE. And in that program, what they're trying to do is to do exactly the same things that we have already been doing with these other patients. So when we applied, we were accepted. So it's a $6 billion market because there are 3 million dementia patients that are on traditional Medicare. This is only open to traditional Medicare patients at this time. And they pay us about $2,000 a year to be able to take care of those patients. They pay us monthly. So that's the $6 billion market that we have access to. Again, what they're asking us to do is what we've already done, and we've shown that we can reduce hospitalizations associated with that. This program is great for the patient and caregiver. There's no cost to the patient. There's no copays, no deductibles, nothing out of pocket. For the caregivers, there's $2,500 of annual respite care coverage to give them a break when you need to have somebody either come in the home or take someone to adult daycare. No MD referral is required. Patients, caregivers can opt into this program on their own. If you don't take anything else away from this session today, is that this is being provided nationally. We're in 6 states, but if you know somebody that has dementia, let them know about the GUIDE program, because CMS has not publicized this. Most people within the industry have never heard of it. Most people outside of it, I guarantee you, have not heard about it. So how are we getting this out in the marketplace and getting patients in? So we look to trusted sources that the patient already knows to be able to refer patients to us. Because the first thing people hear, oh, a new program from Medicare, no cost. Oh, this must be a scam, but it's not. And so we have a B2B2C sales model that provides very steady sales growth with a very low customer acquisition cost. This is because healthcare referrals, you can't pay for them if you're involved with Medicare. Once you build the relationships, physicians don't change their referral patterns easily unless you screw up. So this is a way of building a very reliable long-term business with a very low customer acquisition cost. It doesn't take off like a rocket, though. It takes time to build that network. These are the referral partners that we're focusing on now. There are multiple people that interact with dementia patients that have their trust. One of the key ones that we're focusing on, won't go through all these, but are area agencies on aging. These are across the country. They're the federal government through the Older Americans Act pays for these, and their job is to connect lower income older adults with programs that can help them. We have a program that helps them. This is their mission. Plus, because we have to address the social needs, we are partnering with them to use their social workers and get them revenue, these area agencies on aging. So they have a financial incentive to get involved in these programs. This is where we are right now with the partners that we have across these different channels, the potential patients that we see from these specific. So we have about $5 million of potential annual revenue. It will probably take 3 to 4 years to get to that level, but the access is there. As I mentioned, we're in 6 states. You can see them there. And then this is our pipeline. So these are the people that we're either beginning to implement the referral patterns with, or we're in contract stages. So we got a $25 million pipeline that we're still be able to get a lot of that closed this year, but it will put us on the way. There are 2 phases to our sales process. This first one, which is the fee-for-service payments that we get from Medicare. Very good payer, guaranteed, but it's not a lot. Where the money is when we can go to the Medicare Advantage programs and take on risk to say, okay, we'll do this basic services, but we want to share in the hospitalizations that we reduce and the money that we save you. That's where it really gets interesting, because they have a monetary incentive to get all their patients in it. Plus, the margins go up when we get to share in those savings. Right now, all those savings go to Medicare. We don't get any of that. We just get, the fee-for-service payment. So this really gives us an opportunity to significantly increase the margins going forward. This is our hockey stick. I mean, as I said, it's not quite a hockey stick because it takes a while to build the referral networks and get those going. But this gets us to over $100 million by 2030, and that's important because at that level you have a lot of different options in terms of where are you going to go. Are you going to go public? Are you going to go to PE and sell because they can take this up to another level, or you sell it directly to a strategic?
We've got about 5 minutes.
5 minutes? Okay, good. Better track than I thought I would. We'll have time for questions. This is the team that we've put together, the management team. essentially, we're very geriatrics focused. There are 6 geriatricians on this slide here, and this is what there are very few geriatricians compared to the number of geriatric people there are in our country, and so as a result, they don't get the benefit of this kind of care. We bring a lot of those geriatric principles directly to the patients. Now, I told you about what we're doing, how we're building this. Now, how do you make money? So this is a comparison to other similar types of business, telehealth businesses that are tech-enabled services that have valuations, that are documented out there. Now, the first one, Livongo, diabetes, okay, they got sold to Teladoc for $18.5 billion during the COVID healthcare bubble. It's a completely unreasonable valuation. It almost killed Teladoc because they had to write off about 90% of that, even more than that, I think 95% afterwards. But they, it was a huge success. 2 public companies that went public this year, Hinge Health and Omada, you can go and find their documentation, and you can see that they have very good valuation to revenue multiples. So, diabetes, back pain, diabetes, we're focused on dementia, and on this annual patient savings, this is where it's really exciting because these patients, again, they are some of our most expensive, complex patients in the whole healthcare system. I told you about it, $39,000 a year on average. These people not only have dementia on average, but they have 6 or more other chronic conditions. That's why our nurse practitioners are very good at looking at the holistic needs of these patients, not just their dementia, but what are the other things that are likely to put them in the hospital while we're working with them. That's where when we can show that kind of savings and show that to MA plans and get the higher margins, we have a chance of building a $1 billion valued company within the next 5 years. So what are we looking for? The great news is we have a very low valuation at this point. Right now, we're finishing up a $1 million convertible note with a $7 million cap on it. And we've got about half of it raised. And the purpose for this is to be able to get more patients into the pipeline through those referral sources to be able to get a good valuation on our $4 million seed round. So with this, the key thing here is that we want to get over 200 patients in by the end of the year, get 20 partnerships. We already have 13, and then raise the seed round in Q1.
Are all the nurse practitioners are local?
Yeah. So we hire them locally, by state as we're starting up. As we get more patients, then we'll focus more on specific towns.
Is it mandatory they have to be local?
They have to be licensed locally, but the benefit of having them local is that it's easier for them to build relationships with the patients they're serving, and also the rest of the healthcare team, the physicians that they need to coordinate care with.
People are asking, do you have any customers? Any paying customers?
Yeah. Right now we have 50 patients in the program, and we're we got to the number of referrals where now we're starting to build rapidly. We're this month we're on track to bring on another 20 patients, and we should be doubling as we go forward.
And I've talked like one more question here. I guess they're asking about care.com or other websites you want to look at on screen.
Yeah, so there are a lot of other companies that provide care coordination. We go way beyond that. Again, with nurse practitioners having frequent interactions, the whole idea is to get people to take action. This is what we're missing, not only with this population, this is what we're missing in our whole healthcare system, is doctors do a very good job of diagnosing disease. We have a lot of good treatments and things that we know will slow the advance of disease. Doctors prepare care plans, but they don't get implemented. People don't follow what their doctors say because it requires them to change behavior. And the gold standard of behavior change is having another human being help you do that. And that's what we do by having the local nurse practitioners. So thank you for your time. You got more questions, Marty?
We do have more questions, but you have to answer them at dinner or else offline here.
All right. Well, thank you very much. I'll be around rest of the day today and at dinner. Please stop by and ask me any questions, and appreciate the opportunity to share this with you.
Great. Thanks so much.